Hi, and welcome to Healthy Monadnock Heartbeat. I'm your host, Sarah Caseta, and thanks for joining us today. Today, I wanted to talk a little bit about the Organizational Champion Program, which works with organizations throughout the Monadnock region on their Worksite Wellness initiatives. My guest today is Jen Begley, the Program Manager for Worksite Wellness at Cheshire Medical Center, Dartmouth, Hitchcock, Keene. So Jen, thank you so much for joining me today.
Thanks for having me.
I'm really excited to talk to you. How long have you been at the hospital?
I've been at the hospital for a little over 7 years.
Okay, and what is your background? Have you been working on Worksite Wellness the whole time?
Yeah, so for the last 7 years, I've been working on Worksite Wellness. My degrees are in health promotion and health education, so this was a perfect fit because it's doing health education and health promotion, but with a specific audience, so all of our staff.
Okay, and why should businesses pay attention to Worksite Wellness? Why is it important?
Well, it was important to Cheshire Medical, Dartmouth, Hitchcock, Keene at the beginning because we were charging our community with becoming the healthiest community in the nation. So we started looking at, well, why aren't we doing more for our staff to improve their health and well-being, especially if we're going to go out into the community and say that this matters. And so it was really about creating a benefit for our staff because a healthy employee is a happy employee, and that's one of our goals, I would say. And there is a lot of literature around Worksite Wellness. A lot that came out 7 years ago was on return on investment, and that if you spent a certain amount of money, you would get a certain amount of money back in terms of your health plans.
That's got to be pretty hard to quantify, though.
It's pretty hard to quantify, and we're finding that. And so now sometimes we're looking at what's the return on the value of this benefit. There's still a lot of research on presenteeism and absenteeism, so how present someone is from work, how often they call out sick, and are those related to a chronic condition, a mental health issue, and that's where potentially an employer could see some savings when they're looking at the money. But I think with our community working to be the healthiest community in the nation, it makes sense that wherever anybody works, that wellness is part of the overall benefit the organization provides.
And if they care about their employees, they want to provide a place that they want their employees to be, and employees want to enjoy going to work. So what does it look like? What does Worksite Wellness look like?
It depends on the organization. It depends on the size, but there are a couple of like key components that are always part of a comprehensive Worksite Wellness program. One would be really an assessment and overall strategy around the environment. What does the environment look like? Does it support healthy choices? Does it make the healthy choice the easy choice? There are projects, things that, or I'm trying to think of an example of a project, but projects and also programs. So there's kind of a mixture of classes, workshops, and then making sure that the environment supports whatever you're teaching in those classes and workshops.
Now, I think we have just a couple of pictures of some of the things that you've done at Cheshire Medical Center, so maybe we can bring those up. A walking path. Oh, here we go.
So one of the things that about 6 years ago we recognized was that if you went down to the cafeteria, you could get farther with a certain amount of money by getting a cheeseburger and fries than you could from filling up at the salad bar. So the pricing structure didn't match the goals that we had set for ourselves. So we made a switch. We started to price salads and healthier foods at a more affordable option, and we sat back and watched to see what would happen. And so the amount of salads, we measure it by pounds, it rose substantially over a year's period of time. And so what you'll find now is that if you go down to our cafeteria, you have to wait in line to fill up at the salad bar, where that might not have been the case a few years ago. So allowing the environment to be supportive of that, we've seen a huge change.
Yeah, that's great. Okay, and what other kinds of
So
changes?
Physical activity is super important. We want people to move, and so we want our building to have some accessibility for you to get up and move. So one was beautifying some of our stairwells. We want folks to pass on the elevator and use the stairs. So we created a mural project where there's a set of stairs on the hospital side that are used quite often. And they were pretty dreary. So we had somebody come in and collectively we painted a mural on each of the landings so that they're just a little more, appealing. We created a way we really support walking. It's a free pretty low cost, easy way to get up and moving. So we have an indoor and an outdoor walking path. The indoor walking path is something that folks can use, especially during these really tough months of it being, brutally cold out or snowing, that someone can still get up and get active. And then when spring comes, you won't find yourself being the only one on the outdoor walking path. So it's about 1.5 miles of walking path that's on our campus. And people feel like once it's on our campus, it's more accessible, and so a lot of people utilize that space.
Easier to get up from your desk and say, I'm just going to take a quick break, walk the path.
Yep.
That's great. And how do employees respond to some of these changes, or what are some of the other changes that maybe have been really embraced by employees and maybe others haven't?
So there are some things that employees are super on board with. Whenever we seem to make any changes around food, there's always a challenge. There's always the messaging around that no one wants anyone to be the food police, and that's certainly not our aim. But we decided that while you're on our campus, these are the choices that will be available to you, and that messaging usually helps. Some of the other environmental policy changes we've made on our campus have been widely accepted, like the stairs and the walking path. We have a breastfeeding policy, so folks that are coming back to work after maternity leave can feel that they can still get away and do what they need to do in terms of raising their family. So creating a space where a mom can either breastfeed or pump is really important to us. And that's been widely accepted. And when we do programs or projects and we're communicating those, the challenge really comes down to whether someone has time to participate. So with the hospital and outpatient clinic, patients are our primary concern.
Yeah.
And so people often in this industry put themselves second. So while they may be interested in programs and resources, they don't always necessarily take advantage of them.
I think I read somewhere that nurses are one of the least likely positions to that take care of themselves.
Yep. So it's a challenge for them. And so we try to do a variety of programs that happen on our campus, but programs and resources they can tap into at home. So to make sure that if they can't do it while they're at work, that the resources are still available to them 24 hours a day. One of the things that we do every year is an assessment. So we like to assess our staff and get an idea of what their health status is. And a lot of times that's a quick and easy way for someone to participate, get a sense of where they are, and it helps us to drive programs. So I think there's a chart that says kind of what we've learned from that assessment that we do over the years. And our health needs are really no different than the county or the state or the United States, but weight management, nutrition, physical activity, stress, those are all our top health needs.
Now, what's the difference between the big graph and the little chart?
So the little chart shows us our numbers in terms of tobacco users. So while that number isn't large enough to fall into one of the top 5 health needs, it's one of the health needs that we always focus on regardless of the number. We have a small percentage of staff that still use tobacco, and so it's something we just don't want to forget. We have amazing resources on our campus through the Cheshire Coalition for Tobacco-Free Communities, so I always want our staff to remember that when it's time or they're ready to be free from tobacco, that resource is there.
That's great. But it was a pretty significant focus on weight management in that chart.
Yep. So right now we're running a program called Right This Way, and it's an online sort of competitive program where people are tracking things like sleep, not eating after dinner, ensuring that they have breakfast and that they're weighing themselves once a week. And we have about 200 people that are participating, so each day they're logging in their different behaviors, and there's a team competition to that, so there's been some interesting things happening between the teams, but the research around wellness says that some kind of competitive nature where you can do something with a group usually is more effective.
That's great. Well, as a group, I'd like to take this opportunity to take a quick physical activity break so that everyone can take a moment to get up off the couch, off your seats, and do a 2-minute exercise with the trainers from the YMCA.
Hi, my name is Stacy Wilbur from the Keene Family YMCA, and this is some Move More Minutes. And come join us at the Y and take some of our classes. Bring those heels right up to that bottom. And those arms back. I know you're off your couch doing this. Back. Back. All right, we're going to cross it over. Lean up and cross over. Again, you don't have to be so high. You can just tap, if you like, or make it a little more difficult. Got kids, bring it back. Now if you want a little bit more, you can take it up a notch. Yeah. Or stay here. All right, cross it over. Sorry, guys. Here, if you want to bring it up, bring it up a little bit. Go, Stacy. Woo! Or keep it down.
Okay, thanks. Welcome back. Hope you enjoyed that break with the YMCA. I'm here talking with Jen Begley, Worksite Wellness Program Manager from Cheshire Medical Center. Jen, sounds like you've done so many different projects and programs at the hospital. It sounds awesome. What have been some of the biggest challenges you've encountered, though, with these programs, or what are the lessons learned?
So when you set out to do a program, you do all kinds of pre-work, and one of the lessons learned was thinking about the messaging around the program and kind of exploring what are the potential perceptions someone would have of the program. So years ago, we did a weight loss challenge, and we named it after The Biggest Loser, because at the time the show was really popular, and we thought this will be great. And what we found was that two things. One, someone at a healthy weight wasn't really able to participate, and so they felt left out. And we certainly didn't want that. And then we had folks that took some interesting ways in which to lose weight, especially towards the end, because they wanted to earn prizes. And we figured out really soon after that that is not the message that we wanted to send, that substantial amounts of weight loss in a short amount of time is not the healthiest option. And so while we felt like it was exciting to have people engaged, they were, at some of them were taking unhealthy steps towards getting to their goal.
Yeah.
And so we wanted to make sure that no programs kind of went that way again.
Yeah, that wouldn't be good.
No, yeah. So it really kind of brought us back to, okay, do we want folks to think wellness means losing substantial amounts of weight all at once? No, wellness is really about small, actionable steps that you can take, kind of carving out one small thing that you can focus on. And from that was born this idea of taking your next healthiest step.
Oh, can you talk a little bit more about that?
Yeah, so the messaging was to try to bring off the pressure that folks feel from wellness, that they've got to do everything right away to be considered, a champion or be considered someone that's taking care of themselves. And the messaging is really, it's about small, actionable steps. So your next healthiest step could be drinking water or walking once a week. And so the theory is that if you take one small step and you're able to attain that, then you're more likely to maintain it, and maybe you're ready to take your next healthiest step. So that it's small and actionable, and that it's not all at once. And that's really kind of the journey of wellness, and that most people are on.
That's great. And what are kind of the emerging issues in wellness that you're looking at right now?
So we're always looking at, making sure people are eating well and moving. But what we see at the hospital and clinic, and I know other folks are seeing in their organization, is stress. Our lives are so busy. We feel there's more demands on us. Stress is kind of defined as, having little control over some things and feeling an imbalance between the demands that are put on us and the resources we have.
Yeah. So what do you do to help that? I mean, how can you help people? Through Worksite Wellness, can you really help people manage their stress?
Yeah, so there's this whole idea, and we've been working hard at the hospital to build resilience. And resilience is a skill in which resilience is really defined as your ability to bounce back from an adverse reaction or something negative that happens. And so what we have been learning about resiliency is that there are some of us that are just naturally resilient, and some of us that there are skills in which we can build to be more resilient. So we've been doing a lot of programming on that, about building the skills. We have a program called the SMART program, which stands for Stress Management and Resiliency Training.
Okay.
And so we're really trying to look at how to decrease stress and to build our resilience. And it has been a widely well-received program at the hospital. Folks are really feeling like it has an impact on them.
That's great. Can you tell me what that looks like? I imagine that people have some pretty stressful situations at a hospital with patient care and caring for others.
So the program really is made up of two things, is what we pay attention to, so really kind of being mindful. A lot of times we're in what we call default mode, which is mind wandering, where we're ruminating, and we're focusing on either neutral or negative experiences. So mindfulness really brings our attention to the present moment. And so that has an effect on how we respond to stressful experiences versus react. And resiliency is really about how we interpret those experiences, or sort of the story we tell ourselves. And so we talk a lot about things like gratitude. Gratitude has a way of kind of flipping the switch on how we might be looking at something. We talk a lot about compassion, acceptance, being accepting of the circumstance that's happening now, and maybe being curious about the story we're telling ourselves about it, because it's usually more in the negative side of things. So kind of switching how we think about what has happened to us, whether it's right in the moment or after.
That's great. And what other kinds of programs are you involved with at the hospital?
So we do a lot with cessation. So we want folks to be, we want to remind people about the cessation services. Other programs, I'm trying to think. There's the resiliency programming, the weight management programming.
And you offer programs for the community as well.
We do, yes, we do. So we do a lot for the community in terms of health education programming. We do a lot of programming in the fall and the spring. We offer classes, workshops around healthy eating, active living. And we have one specific program that's coming up this spring called the Diabetes Prevention Program. So we have obviously lots of patients that are living with type 2 diabetes, but we have quite a few patients and community members that are living with prediabetes and don't know it. So some of the statistics are like 1 in 3 folks are living with prediabetes and they don't know it.
Wow.
And so we want to prevent them from becoming a type 2 diabetic. So we are implementing a diabetes prevention program this spring, which we're very excited about.
That's great. Well, I know we have a quick video about prediabetes, so let's take a look at that, and then you can tell us more about how people can maybe find out more about that program.
Okay.
Okay.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up 1 finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
Here we go. We're gonna make some juice.
It's gonna
be
good.
She's excited. A little bit of kale.
Please don't put this on.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Thanks. That is kind of scary. I bet a lot of people have it and don't know about prediabetes. So how would someone in the community find out about this program if they're interested?
Well, there'll be a lot happening over the next couple weeks to let folks know about it, but the easiest way is probably to visit our website. And on our diabetes page, there'll be information. It's called the Diabetes Prevention Program. There'll be a phone number, a form that they can fill out to show that they're interested, and then a lifestyle coach, which are the folks that are going to be facilitating the program, will call someone back, and there's a small assessment to determine eligibility for the program.
Okay, that's great. Well, thank you, Jen, so much. It's been
you.
so good to talk to you and hear about all the programs and all the great work you're doing with the hospital.
Thanks for having me.
And thank you to our audience for joining us today. We're really looking forward to more of these shows talking about what people in our community are doing to make the healthy choice the easy choice for more people, so we can all have healthier lives and we can all become the healthiest community together. We look forward to seeing you next week. Thanks. Goodbye.